In this video, we are going to talk about blood circulatory routes and major blood vessels in different organs. Brain regulates its own blood flow. Total blood flow in the brain fluctuates much less than any other organs. Deprivation of blood circulation in the brain will cause loss of consciousness. It only takes about 4 to 5 minutes to cause irreversible brain damage. Brain has its own regulation for blood flow to match changes in blood pressure and the blood chemistry. Cerebral arteries dilate as systematic blood pressure drops. It constricts as systematic blood pressure rises. The main chemical stimulus in blood flow in the brain is the pH. The level of carbon dioxide in the brain is important for pH regulation. Carbon dioxide can react with water to form bicarbonate salt, which is an important buffer to neutralize the pH in the blood. When the carbon dioxide level is very high in the brain, pH will decrease and it triggers blood vessel dilation. If the carbon dioxide level is low, the pH rises, the vessel constriction will be stimulated. The condition of low carbon dioxide is called hypocapnia. This can occur when the blood vessel is hyperventilated. Such a situation can lead to ischemia, dizziness, and fainting. The damage of cerebral arteries can cause transient ischemic attacks. This is the brief episodes of cerebral ischemia. It can cause dizziness, vision loss, weakness, paralysis, headache, and aphasia. This situation can last from a moment to a few hours. It's an early sign for stroke. Stroke is a sudden death of brain tissue caused by ischemia. Stroke could be due to atherosclerosis, thrombosis, ruptured aneurysm. The effect of stroke can range from unnoticeable to fatal. Whether stroke can be recovered depends on surrounding neurons and the collateral circulation. Lung has the pulmonary circuit. In the lungs, we have left and right pulmonary arteries. The lung has superior lobar artery, which can further branch into arterioles, then middle lobar artery, then the inferior lobar artery. When the pulmonary artery and the veins reaches to the alveolar structures, these blood vessels became capillaries. These capillaries wrap around the sac of alveoli to help with the gas exchange between lungs and these capillaries. This diagram shows the major systemic arteries. Aorta comes out from the heart, is branched into common carotid arteries, which supply the blood to the head. It also branches into subclavian artery, which supply the blood to the upper limb. Aortic arch will bend down, become a descending aorta. From the descending aorta, the arteries will go to different digestive organs and the pelvic region. From common iliac, the arteries will continue extended to become femoral artery and fibula and tibial arteries, as well as dorsal pedal arteries. This slide shows the major systemic veins. From the superior vena cava, the veins will branch into axillary veins and the jugular veins. The jugular veins will support blood in the head. Then the axillary veins will branch into cephalic and brachial veins. Then it further goes to the palm. So we have the radial veins and the ulnar veins, then the palmar veins. The inferior vena cava will branch out to different organs, the renal veins, the hepatic veins to the liver, the pelvic region. Those are called the common iliac veins. Then the veins will extend to femoral veins and the tibia and the fibula veins, as well as the dorsal venous veins. There are some arterial pressure points. These are the points where an artery can be pressed against a bone to inhibit bleeding. We have superficial temporal artery pressure point, the facial one, common carotid radial point, brachial point, femoral point, popliteal artery point, the posterior tibial point, and the dorsal pedal point. The most common problem related to blood circulation is the hypertension. Hypertension is a silent killer that affects about 30% of Americans who are over 50 years old. Hypertension is the major cause of heart failure, stroke, and kidney failure. Hypertension damages heart by increasing afterload. Myocardium can be enlarged, so it becomes overstretched and insufficient in pumping blood. Renal arterioles can be thicker in response to stress. Drop in the renal blood pressure can lead to salt retention, and it worsens the overall hypertension. The primary hypertension is caused by obesity, sedentary behavior, diet, and nicotine. Secondary hypertension can occur along with other diseases, such as kidney diseases and atherosclerosis. Portal hypertension can cause blood pressure to increase in the hepatic portal system. Schistosomiasis is a problem when liver venues being clogged with eggs of parasite forms. This is an inflammatory disease. Hypertension can also cause spleen to be enlarged. Hypertension in the abdominal area can cause fluid leakage. Ascites is the distension of the fluid in the abdominal area. Here's a picture showing the ascites. In summary, this video talks about the major systemic arteries and veins in the body, as well as the results of hypertension.